It's now time for the Weekly with News 6 morning anchor Justin Warmoth.
This is the Weekly on clickorlando.com with Justin Warmoth.
Good morning, I'm Justin Warmoth. With vaccine distribution right around the corner, we know so many of you have questions. Is it safe? Are there side effects? When will it be widely available? This morning, we brought in Orlando pediatrician Dr. Candace Jones to break it all down.
This pandemic has brought on struggles in a wide variety to so many different people, affecting them in so many different ways. So since this started in March-ish, what has it been like for you as a pediatrician and for some of your patients who have come through?
That's a great question. One thing I think of is that we are all in this together. This is something that hasn't happened before in my lifetime or many of our lifetimes. It's devastating, it's scary, so much uncertainty and fear and anxiety. So it definitely has pulled at people's mental health, physical health, danger of having the disease. So it's just impacted people in so many ways. But although we're all experiencing this, we all are not in the same position, right? Some of us are doing okay, are doing well, but some people are really struggling. Certain children are really struggling being out of school. Certain families are devastated because they've lost their job. They're stressed and strained, and all of this is permeating families and wreaking havoc. And I think it will be years to come that we still will be seeing some long-term impact on families, on communities, because of the disproportionate effect it has had on certain groups of people. Absolutely.
No doubt. As people look at the short term, the focus right now has shifted to the vaccine. And there are so many questions that people have. When can I get it? Is it safe? So let's go over some of the basic questions that viewers have had. So why don't we start with, in your knowledge and looking at this Pfizer vaccine, do you believe that this is safe, and would you recommend people getting this whenever they can? Because I know that's different as well.
Right. So I'm coming on board. There's still some things to learn. So I'm just like everyone else. Even though I am a physician, I am seeing patients, I am being exposed to COVID in some ways, less than others in the hospital, I would say. I still have to do my due diligence as well and read these studies and look at the data. However, I am a part of a robust health community. I do trust what Dr. Fauci says. I do trust the leadership of the American Academy of Pediatrics as we look at this collectively and see that it is a very important tool in combat this pandemic, this virus. It's not the end all be all. There are multiple layers of combating this pandemic, but it is one important step. And so as you raise the question of the vaccine, when it's ready, when it's approved, it has gone through phase 3, all phases of the trials. It has been deemed to be safe and effective. So I've talked to my husband, who's a doctor as well, and we both said, yes, we'll take it. My dad asked about it, and he said, I'll wait till you guys take it. And if you do fine, then I'll take it, because he's in an at-risk group. So yes, I will take the vaccine, and I wouldn't ask anyone to do anything that I wouldn't do myself or that I would give to my own children.
A common question that we receive and that doctors, I'm sure, are answering is, I've had COVID-19 before, therefore I believe I have the antibodies. Do I still need to get a vaccine? What would your answer be to that?
So we don't know everything about this. This is still very new. There's a lot of research. We learn something new every day. I know everyone, including me, is tired of all the new data we get that kind of circumvents what we just learned. So it's ongoing. But what we know right now is that if you have had COVID-19 infection, you do have some level of immunity, but we don't exactly know how long are you forever immune. We don't think that is the case, and we don't know exactly how long that lasts. So the answer right now, currently, as of what's today, December the 10th, 2020, is we still believe that you will need the vaccine, because we don't know, or truly with absolute certainly know that having the infection gives you lifelong immunity or long enough immunity to protect yourself and others. And then we also don't know if you still can spread as well. So all of that stuff is still being teased out.
We know that there are several pharmaceutical companies working on their own vaccines. Right now, the focus has been on Pfizer. But when the other ones do get approval and start to become available, will it matter which vaccine someone receives?
I don't, it would be nice to have choices, but at this point, because it's in short supply, it depends on so many factors, like if I can store it, my facility. So you really probably are not going to have much of a choice. It's going to be what your local health department or hospital or facility gets in and what they can safely store and keep up with and give out based on the companies, the vaccine specifics, and then from there. But right now, I think we're just going to have to take what we get. The point there is making sure it is shown effective and it's shown safe. And so far, what we know, both of these vaccines are in that category.
What would you tell someone who's skeptical of receiving a vaccine that was produced so quickly? Because these vaccines have been produced in record, unprecedented times. So what would you tell that person?
My understanding of that process and hearing this from Dr. Fauci with the American Academy of Pediatrics conference in fall, and then also hearing it from world-renowned vaccinologist, Dr. Paul Offit. One of the reasons, many reasons, but one of the reasons why this happened so fast is because of the dire nature of this pandemic, number one. Number two, usually when vaccines are produced, it's over, many years, decades or more. But these are companies working in silos with their resources and their scientists and things of that nature. But because of the nature of this pandemic, you have to imagine governments, the world has poured in resources, and scientists across the world have worked together. So you go from a company to now everyone getting together to work on this. That's why and how you can get it done in quote unquote warp speed. But I do think that name has, it's all about messaging and labeling wasn't the best choice. It can be scary for people that you might have circumvented some very important steps to get it done. But in hearing the presentations from those individuals, I think the clinical trials, the phases were done in the right way, and those important steps to ensure safety and efficacy was not circumvented.
Another big question about the vaccine, how many people will be willing to take it once they have the option? Coming up, Dr. Jones will discuss the challenges ahead to build the public's trust. Stay with us.
This is The Weekly on clickorlando.com with Justin Warmoth.
Welcome back. As we wait for the first shipments of the vaccine to arrive in Central Florida, the next hurdle will be distributing doses and building trust that it's safe. According to Pew Research, roughly 60% of Americans said that they would definitely or probably get the vaccine, and that hesitation is especially apparent within the Black community. Orlando pediatrician Dr. Candace Jones is back now to explain how to build trust so that people can stay safe.
This is a huge deal to have the faith of our community's faith restored in our scientific community. There's so much damage that has been done, and also historical damage. As an African-American physician in the African-American community, we have justified distrust of the healthcare system in science with things that have been done in the past. And so I think of that community when I think of, and I see it in my patients and families with new vaccines because of that historical trauma. But what I think needs to happen, and I think our government, our health officials, we're aware of this. Dr. Fauci's talking about it. The American Academy of Pediatrics is talking about how are we going to message this? Be transparent, be honest, be open, speak to the real issues that people have, not around them. and convince them to take this vaccine, right? Um, and there's so many layers there, but we have to work through that to definitely have a unified message of why this is important, how it can make a difference for all of us and save lives, and that it's our individual and collective responsibility to do this for everyone so that we can get back to some sense of normalcy and reduce the spread of this infection. It's all of our responsibility, absolutely.
Speaking of normalcy, I think the perception from maybe some of the public is that the vaccine is almost here. When I get the shot, I can kind of go about my business how I was going about my business pre-pandemic. No mask, no social distancing. Do you see it that way?
No, and I think health officials have been sounding that alarm. I know people listen somewhat, but this is not going to happen instantaneous. This vaccine is one tool in a whole toolbox of things to combat this pandemic and decrease the spread of this virus. So we can't put all of our eggs in the vaccine basket. We get this vaccine, first of all, everybody's not getting it right away. There are no trials in children. Children aren't even a part of this, which we are asking for that to hurry up and happen. So no timeline in sight for that. Also, every adult is not going to get this vaccine. And even starting at the beginning, only about half of people are saying that they're willing to take it. Mm-hmm. So we have to roll it out to essential workers, nursing homes, veterans, and then trickle it down to everyone else. So definitely remember that herd immunity again. We still have huge holes in our cheese of protection. Mm-hmm. So we won't have blanket protection right away. And we don't even, I think, know if you get the vaccine, how long it will take for your immunity to develop. That may be weeks to months. And then even though you may be protected from the infection and may have less severe disease from getting that infection, can you still spread it? Because we have to remember, vaccines are not 100% effective, right? To prevent an infection. So you still may get COVID. You still can spread it. Although your disease may be less severe. So there's still so much there to tease out. So I say, hold on, continue. Still, the most effective thing we can do is wear our mask all the time, as much as you possibly can. Hand wash, hand hygiene, sanitizing, reducing our numbers as the holidays come. We really have to get on board. I love family. I love holidays. It was so tough for us staying with my household only for Thanksgiving. But we have to do this. Reducing our numbers, taking it outside as much as we can. Even as sports now are going indoors, our young people need to wear their mask while they're playing their sport indoors. Yeah. And so there's so many new recommendations coming out to reduce the spread of this virus. And we still need to fight for more testing and robust testing. So many layers here. So we cannot just bank on this vaccine, and we still have to do all of those other safety measures.
You mentioned some of the inequities and how this has affected certain groups. Testing, while it is so much better than it was early on, it is still flawed, and there are a lot of flaws with the testing system and getting your results back in a proper amount of time. We saw all the people lining up before Thanksgiving hoping to get a test, and not everyone could get one, and what have you. That's a whole nother story. But when you see something like that and the testing, while widespread, still difficult to accomplish, you have to imagine that getting the vaccine when you want the vaccine is going to be very similar.
The inequities of this whole thing, COVID has exposed something that's not new, something that I and many physicians and many people have been screaming for years. Mm-hmm. But COVID has yet put it in our faces, inequities. And with testing, the difficulty you just mentioned. And so I would hate to say this, and I don't want to be a Debbie Downer, but we can see that with the vaccine, those inequities will likely exist if we don't get it together. This whole thing is a tough situation. So there are going to be challenges and some hiccups and things of that nature. But I would hope that we would put on a lens of who truly needs this the most, who's being affected the greatest and the most, and distribute it to them. Be fair, and that's how it should be. And we know where those pockets are. The Hispanic and the African American community, certain communities have suffered. Our essential workers, our nursing homes, our sick and elderly. We have to look at that and make sure we get it to those individuals, those most vulnerable individuals initially. But I think there's going to be challenges.
Absolutely. As a pediatrician, I know you've had conversations with parents about going back to face-to-face learning. So many parents having to make that decision once again with, starting up the next semester in January. So if a parent has a concern about going back to face-to-face, what would you tell that parent who sees maybe their child struggling with virtual and needing to go back to the classroom, but just the health effects that could have? It's a tough balance, I know, but what would your message be to that parent?
Yes, this is really tough. And I never want a parent, and I'm having this discussion in practice with families every day that I work. But my message to them is, it is your decision, but I'm here to help you make the best decision you can. Not if it's right or if it's wrong, because nobody wants to be out in this pandemic, but life is taking us out, right? And so I have parents who, as you said, their child is doing very well virtually. And so they're going to sit tight and stay there. My child is one of those, right? But I have parents, I have students that are not doing well virtually because maybe they have ADHD or learning disability, or they just don't do well sitting on a computer. And so that's one factor that we have to talk about. Also, we have families that parents have to work. They're blessed to still have their jobs, but they have to work and they don't have a job where they can work from home. We have kids, and then the younger kids have to be in childcare. So there's so many layers, so many factors there. And so I tell parents to just really think those things through and make the decision that is best for you, your kids, and your family, because you also have to consider, is grandma living with you? Is she at risk? Or do I have a health condition that puts me at risk in case my child comes home and gives me COVID? And so it is an individual decision. Think through that. Use your pediatrician to help you think through that. I do say that school is essential, but I'm one of the more safe individuals that say, yeah, school is essential in the right situation. But if it's not the right situation for you, your family, and your child, then it's probably not best.
And my thanks to Dr. Jones for her time this week. As always, you can find the latest information on the coronavirus, including details on the vaccine, right now on clickorlando.com. I'm Justin Mormith. Hope you have a great Sunday.